press the bell icon and never miss a video from the Aesthetic Clinics and Dr. Debraj Shome.
Ptosis has a multifactorial etiology, and hence obtaining a symmetric and an appropriate lid height in every patient is difficult, even for the masters. In this presentation, we use surgical videos of multiple ptosis patients with varied etiologies and many different associated problems to A. demonstrate the thought process behind tackling each ptosis patient, and B. demonstrate the surgical nuances employed for each patient to obtain the best possible cosmetic result. Patient 1 is a 56-year-old lady and is the wife of an eminent industrialist. She desires correction of ptosis both for vision as well as desires the best possible cosmetic result for her social status. Given the poor LPS action in this patient, our options were either to perform a tarso-frontal sling with a silicone rod or to perform a LPS surgery, which would essentially have been a Whitnall sling. The patient, however, had a lot of loose skin in the upper eyelid areas, and this would have bunched up on performing a tarso-frontal sling. Hence, we decided to perform a Whitnall sling, which was an LPS surgery and which would have also led to an acceptable lid crease and superior cosmesis. The lid incision is marked and incised at 7 mm to allow for substantial supraciliary lid show and create fuller, younger-looking eyelids and eyes. The orbicularis muscle is incised and the tarsus exposed inferiorly and the LPS muscle superiorly. The shiny orbital septum is identified and incised. Xylocaine adrenaline is injected subconjunctivally in order to separate the LPS muscle from the underlying conjunctival layer. The LPS aponeurosis is excised, the horns of the LPS muscle are left intact, and the tarsus is attached with 6-0 proline sutures to the Whitnall's ligament. 3 such sutures are taken centrally, medially, and laterally. An additional blepharoplasty is performed for cosmesis. The orbicularis layer is closed with 6-0 vicryl, and then the skin is closed with a running 6-0 proline suture. A frost suture is taken with 4-0 silk. This is the 6 weeks post-op. The patient was very happy. Our second patient is a 5-year-old child. The child presented to us with severe right congenital ptosis and severe jaw winking synkinesis. The parents were, however, more concerned about the right eyelid winking, which they said prevented their child from leading a normal life. The right eye had an unusually high LPS action of greater than 12 mm, and since the jaw winking was so severe and occurred with each and every activity involving the mouth, the traditional options would have included either a bilateral LPS disinsertion with a frontalis sling or performing just a LPS surgery in the right eye. However, none of the options elucidated in literature were ideal for our patient, as the patient's parents were not allowing us to operate on the essentially normal eye, so a bilateral LPS sling was out of the question, and performing just a LPS surgery in the right eye would have actually led to a strengthening of the muscle further, leading to an increase in the jaw winking synkinesis, and this was the major problem for the patient in any case. Hence, a completely new procedure was tried in our patient, and an LPS extirpation was performed in the right eye with a frontalis sling. To the best of our knowledge, this has never been reported in literature before. So just as in the previous surgery, the lid crease was marked, incised, the LPS muscle was identified, and a portion of the LPS aponeurosis for a couple of millimeters above the tarsus was extirpated with a bipolar Ellman cautery. 5 incisions are now made in the shape of a pentagon, 2 just above the lid and 3 above the eyebrow. A silicone rod with a long needle is passed through these pentagonal incisions. Here, the needle is seen coming through the gap in the skin which is left by the lid crease incision and the extirpation of the LPS muscle. The needle is again reintroduced and is brought out through the subciliary incision. The LPS muscle is left extirpated, the orbicularis is closed with 6-0 vicryl interrupted sutures, and then the skin is closed with a running 6-0 proline suture. The silicone rod is now adjusted to give the proper lid height and the proper lid contour. The silicone sleeve is now fitted to prevent the silicone rod from slipping. The ends of the silicone rod are now buried in the forehead. The lid is left 2 mm below the limbus to avoid lag of thalamus. The pentagonal skin incisions are now sutured with 6/0 Prolene. A frost suture is now taken with 4/0 silk. This is the 6 weeks post-op picture of the patient. In this snip, the child is eating, and as we can see, with this procedure, the Marcus gun jaw winking has been completely cured. Patient 3 is a 29-year-old man with bilateral congenital ptosis and poor LPS action in both eyelids. The surgical options in this patient would have been a tarsofrontal sling or an LPS surgery, which would essentially have been a Whitnall sling. The surgical results post either procedure would have been acceptable, but since the patient had a severe propensity to keloid formation, as noted by him in response to many minor wounds in the past, it was decided that an LPS surgery would be ill-advised in the patient, and we decided to perform a tarsofrontal sling with a silicone rod in this patient. This illustrates the sort of thought process which can go into ptosis surgery. The tarsofrontal sling procedure through the silicone rod is now demonstrated in another patient. This is a photograph of the patient taken 3 weeks post-op. The patient was very happy. In summary, ptosis surgery is complicated and needs an individualized approach to each patient. In today's world, where every patient wants the best possible outcome, having skills is one thing, but understanding what the patient wants is the most important.
Hello, I'm Dr. Debraj Shome. I'm a facial plastic surgeon. I trained in the United States, Singapore, Europe and India, and now currently I'm practicing in Mumbai, India. Facial plastic surgery is a specialty in which plastic surgeons train only in surgeries of the face. This is a very nascent specialty in India, and there are only 3 or 4 surgeons in the whole of India. Thank you for allowing us to participate in your case.
Thank you for listening. Do not forget to share, comment, like and subscribe to our videos from the Aesthetic Clinics and from Dr. Debraj Shome.